Okay, perfect. Hi everyone. My name is Khalid Abdelhafiz, if you want to say it the right way, or Khalid Abdelhafiz. This is another way to say it. I'm a PEM consultant up in the northeast of England in Sunderland Royal Hospital. Having been a consultant for a long time, it's been only about 6 months ago, and I have gone through this start assessment about 12 months ago. Um, and all I'm gonna do is basically just to reflect on my own experience. I'm not a professional in teaching. I'm not having got any degree in medical education or anything like that. So just a normal pediatrician, a regular pediatrician, like most of you, basically. And the teaching is it's about bedside teaching, and it's a skill that you'll be assessed. Your skills will be assessed in the start assessment. It's about bedside teaching, nothing more, nothing less. Right, so we'll make a quick start then.
Thank you so
So
much,
basically,
Khalid, for joining us today in our fourth start session about teaching tips. And welcome.
thanks, Ayat, and thanks for inviting me. I forgot to say that I'm also a member of PSAPCH. I always like to say that I was the one who um, designed the logo of PSAPCH. So that's my biggest pride. Perfect. So today we will be mainly hopefully it will be like more of an interactive session. The agenda mainly is about giving you an example of teaching, um, quickly discuss together why it's not really good. Sometimes some forms of teaching are not really the best. Quickly review the RCPCH standards, um, and what kind of assessment criteria the assessors will be looking at when they are assessing the candidates, and do another exercise, another practice, a quick one, and quickly summarize at the end. And I can reflect on my own start experience and my own um, example that I had in my start. So we'll make a good start then. This is the task, basically. You are the general pediatric consultant in the ward. So this is how exactly it will be on the assessment. You will be given a role. This is your role. You are the pediatric consultant. The task is to teach medical students who've attended the ward round and a little bit of context. So you can read quickly. So the night team handed over. There was a baby born with clinical features of Down syndrome, and there are two medical students who are joining the morning round, and they want to be want to learn about Down syndrome, basically. How are you going to tackle the task? I don't know if anyone wants to do it. So I will just maybe give you like 2 minutes to read the scenario. And tell me if anyone wants to do it. Otherwise,
Anyone
I'm happy.
want to participate, please?
Good morning, Faiza. I think there are some comments on the chat. Anyway, if not, I'm happy to do it quickly, just to show what can go right and what can go wrong. Is that all right with you, Ayat? Are you happy to be one of the medical
Yes, it
students?
is all right. I will
Yeah.
be, no problem.
Yeah. I don't know if anyone else wants to like just switch on their camera. Anyone is happy. I mean, I know that sometimes it can be difficult. It's just to be like one of the medical students, just to make it a little bit more interactive. If not, that's absolutely fine as well.
I can do the first one. If someone want to do the second one, I will be happy.
No worries. Perfect. So, Emma. Yeah. Thanks, Emma.
Hi.
You are muted, so I'll just switch it Perfect.
Hey.
Hi, Emma. You're right. Thanks for turning up. Um, uh, Emma, are you one of the candidates for next start then? Yeah.
I don't know, to be honest. I haven't been told if I've got it or not.
Lovely. No worries. That's actually perfect. So let's assume that you're not really sitting for the start, and you are just year four medical student who's just joined the word round in the morning. And I will be trying to teach you today. Is that all right?
Yeah.
Perfect. Okay, let's make a start then. Hi Emma, hi Ayat. So you are the medical student who are joining me today.
Yeah.
Yes.
Okay. And what do you want to learn about?
Well,
I saw one patient. Yeah, I saw one patient with it is put a diagnosis of Down syndrome. Can you tell us about what's Down syndrome?
Yeah. That's fine. I don't know. They teach you a lot in about I don't think they teach you a lot about Down syndrome, and I don't think it's really your level. But anyway, I will just make a start. Do you want to sit down somewhere in the room? I will just be telling you a little bit about Down syndrome. That's okay. Okay.
sure.
So basically, Down syndrome is it's a congenital problem. Okay, so it's a congenital problem. It's trisomy 21. Basically, there is a problem with the chromosomes. There will be always like additional chromosome. That's why they will end up having these features. Those moms will be normally screened just before there will be two. They will be screened, like during the pregnancy. There is a lot of tests that can be done during pregnancy just to pick up cases of Down syndrome. And there is a national program for screening, actually. I can't really remember what's about exactly. So basically, what's happened that every woman will be screened for Down syndrome. And once the baby is being delivered, the baby will be assessed by the midwifery team. They will be asking us uh, to assess the baby quickly. And if there are any clinical features, then we will be doing a lot of referrals. One of them is for cardiology, and we might also arrange for follow-up. What I wanted to know is basically Down syndrome can have a lot of problems. It's a multi-system problem. Okay, so it can have neurological problem like hypotonia. It can have cardiac problem like congenital heart problems as well. Um, and the life expectancy has improved a lot recently. Let's say over the last 30, 40 years, they can survive for a long time now compared to previous eras. Um, and we have in our hospital here we have a clinic mainly dedicated for Down syndrome. One of my colleagues is actually doing it, but he's retired now. So one of us will be taken over. Um, for you, I don't think you need to know a lot about the genetics. I don't think that they teach you that a lot in the medical schools anyway. So I think this is all you need to know. Um, so if you have any more questions, you can go and read if that's okay. Is that all right? I will go and catch my the rest of the word round. Okay, bye. Thank you. Horrible, isn't it? What do you think, Emma?
Yes.
Uh, yeah.
Yeah. No, it's not good,
I
isn't
got
it?
a comment. You didn't even stop. You didn't even stop. You didn't even say it. We are in the same track or not. And you left us without any asking a question.
Okay. I thought I did good.
What do you think, Emma?
Okay. If I'm going to be honest, I think you used some jargon at the very beginning, but then assumed that we didn't know what Down syndrome was, but that we did know what congenital was. And you didn't really say that Down syndrome is also called trisomy 21, which basically means 3 genes in chromosome 21. And that is the kind of fundamental bit of Down syndrome. And yes, you talked about the various kind of sequelae associated with it. But again, it was very much, I don't know. I thought it was okay.
You did it. All right. Would you pass me?
You launched into saying it's a congenital condition, but
Okay.
we don't know. You've assumed that you haven't asked us. If I was doing it, first I would start by saying, what do you know about Down syndrome? Have you ever heard of it? So that you have a baseline of where you start, because you're assuming that we know nothing about Down syndrome, but yet we do know what congenital means. And I would say that congenital is probably more jargon than Down syndrome.
That's correct. What about the way I engaged you? I think I did ask you some questions at the beginning, right?
You didn't ask us what we knew, but you did.
All
Yeah,
right.
you did engage us. Yes.
Did I? Okay. Okay. That's good.
No, I think he didn't. He just being talking until he finished, and he mentioned he will go to his word round. He didn't even check our understanding. If I am a medical student, I will just ask, did you understand any question in between? I think a bit of pause or something like that. He just gave us a push of information and he left.
Okay.
I think I would have had some sort of aims or objectives, some sort of conclusion.
Okay. So basically, Emma, what you would do differently, as you just said, you would use less jargon than me, definitely.
Yes, I would. I would also ask the medical
Ask about
students what they knew before I launched into, so that I knew I could pitch it right. And then I would probably have kind of 1 or 2 objectives to get across.
1 or 2 objectives. Perfect. Okay.
I would kind of probably break it down in terms of it's a genetic condition and talk about 3 chromosomes on chromosome 21. Not sex related, can happen in boys or girls. You talked a little bit about antenatal screening. I think I probably would have gone a bit more simple and just said when mums having ultrasounds, they test whether or not there is increased neck thickness of the baby, of the fetus, and this can mean, if there is this, that they are at an increased risk of this condition. And then I probably would have said something along the lines of, this condition when born, you may have seen.
That's great. And yeah, that's perfect. So you think you would have done better than me? I think so. You think so? I totally agree. I totally agree, Emma. I think you'd have done a much better job than me. Basically, I've seen this kind of scenario, this way of teaching, many times throughout my career. All right, you will be the recipient of information. The consultant has got absolutely no time. They're busy with their clinics. They've got exactly 4 minutes. They want to vomit. Let's just say it. Let's just vomit a lot of information and just leave. And I've seen it. It's not like it doesn't happen. It does happen. And basically that's why I wanted to so in the start, they want to make sure you will not be that kind of consultants. You will have at least a structure to what you are teaching. You know, you will do the basics of teaching, bedside teaching, the just the basic manners, which is, as you said, absolutely, you correctly said, there should be at least 2 or 3 points to be delivered, and that should be at least prepared before you actually deliver the teaching. You need to have an interaction with the recipient, like at least. I didn't even ask what level of, I mean, I know that you are like third or fourth year of medical students, but what kind of prior knowledge do you know? Sometimes in the teaching, in the start, they will the actors will say that they are ST1 or ST2. So basically the prior knowledge or what they know will be a little bit different to what medical students know, and the assumed knowledge should be different as well. So that should be tailored down. Again, having a structure, having an introduction, having the 3 or 4 points that you want to deliver, and a summary at the end is really important. What did other people say? Think in the scenario. What was there anything do you notice about the tone? About the tone of the information delivery? Let's not call it teaching. What do you think, Ayat?
I think your tone is like you give just all the information without any stop, and in a bit on rude way, if I can say clear. You mentioned, I don't know what's that one, but you didn't mention, you didn't offer, you will go and check it and come back and give them this right information.
Exactly. So yeah, it's some people will also say that they can be very monotonous. They can just talk very slowly or very on like just one tone throughout the 4 or 5 minutes, and basically it's kind of boring. Um, and one of the comments I had in my assessment was they actually enjoyed it, right? And if someone is enjoying your teaching, that means that at least you were doing a little bit of an act, isn't it? So that's why it's a little bit entertaining rather than boring. So we, we we don't really have to be entertaining, but at least try not to be boring. So I'm just gonna go quickly through the RCPCH standards of bedside teaching. RCPCH is expecting you to deliver an interactive dialogue, so basically encourage questions rather than just tell them all in one go. Um, Second thing is to be structured, so at least to know what you're talking about at the beginning, like an introduction. Give a quick case discussion, right? And when I say case discussion, the expectations from you is to teach something that they will not find just by Google search, right? Or by looking in a book. It's basically it's better to be something more practical, something from your own experience, um, something they really will learn on bedside rather than just on a book or on a website or an article. And at the end, summarize. My tip to you would be to, when you prepare for the scenario, write down just three points that you want to deliver, not more, not less. For example, in Down syndrome, you want to tell them about antenatal screening. That's most of the kids will be picked up antenatally. Just admit I'm back. Second thing, I want to tell them about trisomy 21, just to link them to the basics. Number 3, I want to tell them it's a multi-system problem and there will be a lot of professions will be involved. That's the 3 points I want to deliver, right? What I can do in general, I can give the first one as someone said on the chat, just tell the information or deliver the information and check understanding. Start with the second one. Again, spend 1 minute explaining it and check understanding. And the third one as well. And at the end, just summarize the 3 points that you already delivered. It doesn't really, you don't really need to know the subject. I'll tell you what, my task was to talk about COVID vaccination in children. And guess what? I absolutely know nothing about it. Okay. It's just about making it simple. They are not assessing your knowledge. So let's just all remember that they are not assessing your knowledge. They're just assessing your interaction, your structure, your adaptation to the learner's kind of level, right? And basically your structure and how can you just deliver this in 4 minutes without boring everyone around you. Checking understanding is really important, and summarizing at the end, as I said, signposting at the end, basically, rather than just go and read. Now, basically, I think there is a really good, even if you make it up, there is really good online um, uh, half an hour kind of CBD you can access on Down syndrome kind of charity website that basically it will be helpful for you to explore. Anything would count, right? I just try to signpost at the end to some learning resources, right? So just again from the RCPCH, I don't want to like again give you a lot of details, but basically if you are teaching about something that will need consent from the parents or consent from the patient, that needs to be done. Make sure that it is relevant. Um, Make sure that you have started with very clear objectives at the beginning. So today we will focus on recognizing clinical signs of Down syndrome, or today I will be giving you an overview about Down syndrome. Again, we're talking about, a lot about Down syndrome today, but basically it can um, you can talk about anything, even that without any prior knowledge. Just make sure that you have very clear objective at the beginning. Um, Dialogue. So what I would expect, what I have expected myself to do is to talk less. This 4 minutes, try to make it like 50-50. So 50% of the talk should be done by you, and 50% should be done by the actors basically, and just keep it going as a dialogue, as a discussion. Najla has been asking, did ask, what if they ask a question that I don't know? They will not be doing that. And
Yeah.
the tip is you you will be driving the discussion, not them. So you don't have to give them a very long pause. So they will be asking you questions. What about? What about? No, it's basically you will be asking the questions, Najla. You will be asking them, what have you learned? What do you know about this one? How would you counsel these parents? How would you manage this kind of kids? Um, as we will see in a second. All right. So, and again at the end, just make sure that you recap the three messages that you want to them to take home, um, and finish with it basically. Again, it should be learner focused, and I think this will be one of the assessments um, points. Uh, Tailor complexity, adjust to the learner level. Check understanding, as we said, and ask them again to teach you back. One of my colleagues was just telling me that his task was to teach about pediatric fractures. And all he did, he's just mentioned before, he just threw the question back to the students and asked them what they know about pediatric fractures and how they manage it. And he basically just summarized at the end, and he was given above expectations kind of assessment. So yes, it's not about the subject. You don't have to know anything about the subject. You can't really prepare by learning everything in pediatrics just before you go for a start. It's just about the way you deliver the teaching. And again, at the end, you can. This is just like some points or some ideas. You can talk about clinical skill integration. Again, you can link basic science or theory to practice for like pathophysiology, basically. Um, and yes, something that I didn't do, which is real-time feedback, because I didn't never even ask a question, right? I didn't even ask you to engage with me, Ayat.
Yeah.
It's basically to give the feedback on the spot. Um, well done for saying this. Yes, that's absolutely correct. But what about this? You know what I mean? Is to give, to praise and suggest. all throughout the scenario. Some of us will just do this naturally. I know that for a fact. Some people will not even need this reminder, but I know some people on the call will just need to structure their teaching a little bit so they can just get the maximum score. So
There is a question in the chat, Khalid. Muhammad
yes,
asked
please.
how can we keep the actor engaged? They are acting or not paying attention.
Right. So again, the role of the actors to pay attention if you give them attention. Let's just say it this way, right? I've done this like two or three times. They will be giving you attention. They are taught, they've been told to engage with you if you are engaging them. If you left them just without even asking, they will not. Believe me. Both of the actors, they will be assessors themselves, but sometimes they can be yeah, they can be the real actors. So basically, they will be true medical students and pediatric
True medical
trainees.
student, yeah. And they can give
Yeah,
feedback,
they
I
will
think,
be.
at the end.
Absolutely, yeah. So, and I will show you a little bit about it in a minute. Again, what RCPCH is expecting you to do to be interactive, to be clear and concise, linking theory and timely feedback. This is just like a summary. Try your best not to lecture. Try your best not to just ramble the teaching, not overload them with jargon, a lot of congenitals and trisomy 21 and a lot of specific genetic science, and basically not giving summary or takeaway messages. This is all not good. Right. I think this is enough of me talking. What I think it will be good, we've got about like 25 minutes. If someone wants to do a scenario, this is I mean, let's just remind everyone, this is a very safe environment. This is the best way to learn. And we've already talked about the points that we want you to do. So I don't know if anyone wants to help us doing a quick scenario then. And I promise I will be a very good medical student.
Anyone
Right?
want to participate,
Anyone in the
please?
chat? Let's just give them 2 minutes or a minute. Right? Basically, as I said, it's only 4 to 5 minutes station. There will be like 2 or 3 medical students or pediatric trainee in the call. There will be one assessor. They will all be on the call with you, so you will be actually seeing them, and you will be able to see their facial expressions and interactions. Their names will be very clear on the call as well, so you will be able to call them by their names. Um, and it will be easy to engage them if needed. So
Do I need to introduce myself, Khalid, when I start the teaching? Do I need to introduce myself to them, or
it's absolutely it's a good practice, isn't it? You just assume that you are actually you can tell them, all right, by the way, I am Khalid Abdelhafiz. I am the consultant that you've made the world round with this morning. Just in case we've got like new faces, and just crack on. So
anyone want to participate, please? Feel free to
I think
unmute
it will be
yourself
good.
and go ahead.
Is Emma in the call?
Yeah.
Is Emma still in the call? No.
I think Emma left. But anyone,
Emma, that's fine.
will be the
That's
same
fine.
scenario, and Khalid promised he will be a good student and he will give a good feedback.
Hi, good morning.
Good morning.
Yeah,
Hi, good morning.
good, but please forgive me. I can't open the cam because it's broken.
No
No
worries. Who's that
worries.
again?
Sorry?
Is that Faiza? Faiza Kamel.
Yeah, Faiza, yeah.
Perfect. Hi, Faiza. Right, Faiza, are you sitting for the start then? Yeah.
Yeah.
Perfect. And lovely. So just to make things simple, I will not be giving you a new scenario. It's the same scenario. So let's just go back and do it. Okay. We've already talked about the tips, what to do and what not to do,
Okay.
right? Do you need any time to prepare, or you're
Yeah,
just happy to crack on?
2 minutes if it's possible.
Yes, absolutely. Yeah, no worries at all. So tell me, like you can think out loud, all right? So
Okay.
in these 2 minutes, what are you going to do?
I will ask the student about how much information he knows
No, no,
about.
I mean in the 2 minutes preparation.
The
So you're
preparation
going to
time.
prepare for 2 minutes, right?
Okay, yeah.
Yeah. So let's just prepare with you, okay? Let's just assume that you are preparing now. So
Okay.
what's the first thing you want to write on your preparation note?
Ask the student about the information he knows because I need to know what I need to explain to him exactly.
Mhm.
And the second
Okay.
thing about the features of Down syndrome.
Okay.
The third thing is about the antenatal screening. And
Okay.
as well, finally, the follow-up we need to do for any patient with Down syndrome.
So, Faiza, what I want you to do, which is
Oh,
absolutely perfect, you've nailed it. But what I want you to do is to write 3 pieces of information, right?
okay,
3 points that you want to teach. Just
o-
3.
okay,
Okay? Just let's do it together, all right? So now it's Down syndrome, right? What are the 3 pieces of information you want these medical students to go home knowing today?
okay. The features and the
So
diff
what are the features that you want to write?
like the facial features and the complication of Down syndrome.
Mhm.
And he needs to know there is follow-up in the future for any patient with Down syndrome.
Okay, I totally agree with you. But don't you think that's the facial features and
Mm,
the clinical features are just at least like 6 or 7 or 8? And
yeah.
then again, when it comes to complications, they are a lot.
Oh,
And the follow-up. So again, for the sake of the teaching today, because it's only 4 or 5 minutes only, that's it.
oh,
Okay? I don't think it will be enough time. What
uh,
what I want you to do is just write 3 things that you want them to learn. Just 3. Because if you overwhelm them with information, they will just forget it all. Let's just be
okay,
honest. Okay. So again, rather than writing the facial features, you can maybe say 2 or 3 of them
okay,
rather than or maybe hypotonia.
okay.
Okay. And then the antenatal screening and maybe something about follow-up. Is that what you want to do?
Yeah.
Perfect. Just share it with us while you're doing it. So what is the first one?
For example, I can say a broad flat face and short
Perfect. Yeah.
nose,
Okay. Okay.
and, and some complications such as congenital heart disease.
Congenital heart disease. Yeah,
Yeah.
I think that's enough. Perfect.
Okay. And umbilical hernia, for example.
And umbilical hernia, that's fine. So that's 2 complications, and yeah, that should be enough.
Yeah.
Mhm. What else? What
And
about the antenatal screen or the genetics? Do you want to
yeah,
teach
it's
about them?
during a pregnancy between 10 weeks to 14 weeks. It's combination between blood test and ultrasound.
Okay.
And I don't think I need to give more information and details about that. What do you think?
I think that's enough. Yeah, that should be fine.
And for follow-up, he needs to know the patient
So
with Down.
so this is 4 now.
Sorry?
So now you will be teaching them 4 aspects of Down syndrome management, not
Okay.
3.
So,
Remember,
okay.
we said only 3. And
Okay.
and just to make it simple is just to make it easy for you, because now you know about this subject, all right? What about if they
Yeah.
ask you about any other syndrome? You know what I mean, right? What about if they ask you about I don't know, like cyanotic spells in kids or B-GALS assessment? You know what I mean? Not on the spot, you might forget everything that you know. So
Yeah.
that's why when you have a structure before going to the teaching station, just write 2 or 3 tips
Okay.
or like 2 or 3 information that you want to deliver, and that's it.
Okay.
Okay? Don't overthink it. Put all of your effort in the way that you are teaching.
Okay.
Okay? So remember, check prior knowledge,
Yeah.
engage them,
Mm.
keep asking about understanding, all right? Start with the structure, so introduction, the 3 points that we've just said, and summarize with the 3 points again.
Okay.
Keep smiling,
Okay.
keep your body language as engaged as possible. I know that we will not be seeing you in the because your camera is broken, but that's fine. And just try your best to be interactive. Is that okay?
Yeah.
Lovely. Right. So we are ready for when you are.
Okay. I'm ready now.
Perfect.
Yeah.
Hi. Hi.
Hi, Khalid. How are you?
Absolutely fine. Thanks, Dr. Faiza, for teaching us. We are so excited to be here. This is my first case ever to see Down syndrome. Oh my God.
Yeah, it's a common condition. Can I ask how much information do you know about that, about Down syndrome?
Oh yes. I've seen one case in Grey's Anatomy the other day, and it
Okay.
was, I think they had a heart problem, um, and I think the parents were a little bit old. Yeah, I remember. But that's all that's all I know about it.
Yeah, yeah. You're right. It's heart problem is one of the complication of Down syndrome. But what we need to know, this condition happens during pregnancy. What we know as well, the patient with this condition will have extra chromosome that will cause a lot of problems for patient with Down syndrome. Do you know what I mean by problem or features? Have you noticed
Um,
anything with this patient we saw today?
yeah, I thought the baby was a little bit he looked different.
Yeah,
He did look different. Uh, I, I think I've seen his tongue a little bit more protruded than I would expect with other babies, but
yeah,
I'm not really sure if that was one of the things. Also,
yeah,
his eyes were they were just not what I would normally see in new babies. What do you think, Ayat? I mean, I think Ayat was with me there as well.
yeah, yeah. What do you
Yes.
think, Ayat?
Yeah, I saw it is like a bit of not like a normal baby, a bit of the eyes doing like normal shape.
Yeah, you're Ayat. The patient with Down syndrome will have some facial features like the change in the shape of the eyes, uh, large tongue, in addition to other features. But as well, there is some complication from Down syndrome. Have you heard about anything about that?
We heard that children sometimes they are being like a bluish discoloration on their lips. But I want to ask, is it the children born with this feature or they can get it when they're becoming older?
Most of times they will born with these features, but the complication may happen later.
Okay, all right.
Hmm.
I thought everyone will have the same complications, if I'm being honest. Um, Silly me.
Yeah,
Okay.
that will be different from child to another child. Not necessary to all the patient with Down syndrome will have the same features and the same complications.
Okay. All right. No, that's good to know. Um, how can we tell them about it? I just don't know. I
Actually,
was just a little bit confused about what to do next, you know?
yeah, usually what we need to do is some follow-up, like some echocardiogram with behavior assessment with the time. From time to time, there is a specific guideline for that. I can give you a leaflet to have a look more about that.
Oh, that would be great. That
Yeah,
would be good because I was just so excited to learn about it. Yeah, okay.
yeah. And what I need as well you to know, there is screening test during pregnancy. So most of the parents will know that their baby may have Down syndrome. It's combination between a blood test and ultrasound.
Right. Okay.
And in the
Nice.
leaflet I will give you, you can know more details about the kind of a blood test.
Oh,
Is-
that's
That's
great.
interesting. Yeah.
yeah. Do you have any questions I can help?
Actually, I think I've learned a lot today about Down syndrome.
Okay, that's good. So,
That's way more than what I've learned on Grey's Anatomy.
yeah, and could you please, one of you summarize what we have discussed today?
Yes, I can tell you one thing I've learned. The screening is so most of the moms will know about the baby who's got like Down syndrome before they actually deliver.
Yeah,
And that's a combination of a blood test and ultrasound,
yeah,
like a
that's,
blood done antenatally. Yeah.
yeah. What's about you?
And also, yeah, I learned they was born with abnormal feature and they need a follow-up to check the complication.
Yeah, that's good. And so I can give you a leaflet as well about Down syndrome to know the features and follow up. And there is a specific guideline about how we can follow the patient with Down syndrome. Is that
That's
clear
great.
so far?
Absolutely. Yeah. Thanks so much. I
Thank
think yeah,
you.
that was so useful. Thank you so much.
Thanks
Thank
so much.
Bye. Bye.
Bye.
Right. Well done, Faiza.
Thank you.
Right. So well done. Well done for summarizing at the end as well as Najla said.
Yeah.
Um, Faiza, what do you think? How well did you do?
Actually, I'm not sure if I need to give more information or details, or it's enough to give like basic information, and at the end we'll give like a leaflet or some guidance or reference to read from it.
Yeah, perfect. I think you did absolutely great, if I'm being honest. I think you did stick to the 2 or 3 points that you wanted to deliver, and that was absolutely great. You summarized at the end, you kept them engaged. So and yeah, absolutely. I think you did well. I actually think you did well. My only comment, I don't know if Ayat would agree with me if about the introduction bit. So maybe you could have started a little bit about maybe introducing yourself, or
Oh,
if they know you already, you don't have to do that. But basically, just a little bit about information, like layout or structure of what you're going to teach them about.
okay,
Today, I'm going to tell you, and we're going to talk about Down syndrome, screening, features, and management plans.
okay,
Um, and then start with asking questions. But that's my only comment. But otherwise, I think you did great.
okay. Thank you.
Yeah, I think you did excellent. You check their understanding, you check what's their information before what is the Down syndrome, as you mentioned. And you being on the track to ask us in the question, what's any other question, and you summarize at the end. Well done. I think you put it in the simple way because, yeah, it is only 4 minutes. I don't think there is a lot of time to give a lot of information about that. And
All
also,
right.
you answer the question about the complication it will happen with every Down syndrome. You answer it in honest way. Yeah, it is not a common, and I can give you a leaflet. It's different from patient to patient. And this is, I think, it is good because you give right information. You didn't just assume what's going on.
Okay. Thank you very much, Ayat.
Well
Thank you
done.
for your taking a part.
Perfect. Any other participant? Any other comments on the chat? I just can't see it. And if anyone else wants um to give to give us a feedback. Okay, I think there's another comment. Yeah, that's just the feedback. That's fine.
Yeah.
But yeah, I think this is it really. It's not that complicated. I didn't want to complicate things. I mean, teaching is one of the um, straightforward stations, if you want to say, in the assessment. Some people are, as I said, just natural and just doing it without previous preparation, without previous experience. And I thought this is just to structure your approach more than anything else. Again, it's just when I said to Faiza, the introduction is just something like hook, like um, what about the case that we've just seen today? Did you see the hypotonia? Did you see how hypotonic the baby was? Oh, or have you noticed the facial features? Again, as Faiza did, it's just something to start the conversation more than anything else. And basically interactive steps and to close at the end, as Faiza did. So well done. Again, at the end, I just wanted to just to take away kind of messages. Don't lecture, definitely. Encourage the participation and interaction. Um, just 3 points, not more, please. Just 3 points. Anything more than this, it's actually like a conference talk rather than a lecture. Okay, so just 3 points when you're doing a bedside teaching. Start with a clear introduction. Uh, be interactive as much as you can, and conclude with a concise summary at the end. Normally, if it was like another teaching, so you will include a little bit more of visuals, but obviously not in the start assessment. Um, and just keep checking understanding. Um, the rule is 1 minute or like 50 seconds of talk, and maybe another 20 or 30 seconds of questions and engagement. If you make it all about engagement and just like a dialogue, that's absolutely fine as well. All right.
Khalid, I got a question. Can we
Go
able
for
to
it.
share a slide on the teaching or not allowed? Just talking.
No, I think from technical point of view, it will be
Mhm.
difficult to do any
A slide
sharing
share.
because
Mhm.
yeah, unless they've changed recently, but over the last 3 or 4 assessment, it was the interface will not
Just
allow you to do
talk.
that. Just okay, exactly.
Thank you so much.
Um, what I think actually, it's a good question. I know that some people have done it before. They basically use like they draw something on the paper.
Mhm.
Like they will have like a paper to hand, and basically they will draw something. If you want, so
And
just to
they can
show
put it on the camera. All right.
put it on the camera, so you can do that. You can absolutely do that.
Exactly, because if it is a topic about congenital heart disease or anything, you want us to draw the heart
If
structure
you
or anything
if you want
like.
to do it quickly, yes, absolutely fine. I mean,
Mhm.
they will not expect you to do that, and you'll be the only one who's doing that, which is fine. It might give you extra points. You just
All
try to
right.
make it yeah, just try to make it simple. Okay. Again, I think the only thing I didn't say before, it's just be yourself, be human, smile, body language, be relaxed. I mean, I know that's a difficult to ask, but still be
As
relaxed.
stress.
I know yeah, it can be stressful, but just think of these assessors or like they are real medical students. So nothing really to worry about, and be simple. Right? So before I finish, I wanted to show you my own start, okay? And basically it's a topic that I didn't know anything about. As I said, it was about COVID vaccination in children. Um, it's not something that I've even like explored a lot. Um, and you can see that, yeah, the marking was absolutely fine. It's funny that you could see that when it comes to the knowledge, uh, it's just as expected standard because basically I didn't know anything more than what would be expected. But it's about the teaching. It's about what to say. It's about the structure. It's about the engagement. It's about the professional approach. About the communication as well. So you can have like 2 minutes reading this, but I just want you to read the first paragraph. What the assessors wanted me to do, right? Because this is will be what they will be marking you against. That you understand the learner's needs, right? So that's why checking prior knowledge is really important. Number two is that you can manage the teaching, right? By focusing on a specific topic, right? Or a specific point. And taking into account the time available of and the level of understanding of the learner. So this is exactly what we did today. Just stick to very basic 2 or 3 points and just stick to it. And this is what you'll be marked against or marked for. And the last one is ensuring the learner's needs are met. So it's not only about telling them what you want to tell and leave, to your ward round or your other business, but basically make sure that they have retain the information that you've just told them. And that's through interaction and directing the learner to other resources, as Faiza correctly did. Right? There will always be suggestions in every single station, even if you did well above the competence level, there will always be suggestions at the end. Okay, so for me, they basically suggested for me to take some of the GIC courses or teach the teachers just to develop it even more and more, which is absolutely fine. I've already done that, but this is just they have to write suggestions. They have to give you like a constructive feedback, basically. So that's basically it. Teaching is one of the straightforward ones. All you need to do is to be yourself, to be structured, to summarize at the end, and all of the points will be in your pocket. Thank you, everyone.
Thank you so much, Khalid. On behalf of everyone, I would like to thank you and to thank the British Sudanese Association of Pediatric and Child Health for organizing this event. And I put the link of the feedback, please, if you can fill it, and let us know about the future session about the start. And if you got any question for Khalid, feel free to unmute yourself and ask.
Yes, please.
Anyone got any question?
Yeah, I've got a question actually. Obviously, yeah, you got above expectation, no concern about your teaching, and from what I understood, you did the start quite not so long before your CCT. Did you have to remediate anyway on this? What did you have to do if you get above expectation? Do you have to prove that you have attended courses, all the suggestion that they have made?
So once you finished your start, there will be, again, the feedback will be very detailed, as I said. You don't have to reflect on every single station if you passed it or like you had above, if you performed at the level of the expected level or above the expected level. It's totally up to you. If you want to take some points on, that's absolutely fine. But most of us, what we did, basically, we met again with the education supervisor after the start and made like a small BDB, right? Like a plan of development based on the start outcome. And this will mainly reflect the stations that you have been given needs improvement mark. So rather than reflecting on every single one of them, so basically, yes, there will be again 3 or 4 suggestions on every single one. That's for you to take home, but it doesn't need to be reflected upon just before CCT, if that makes sense. Does that answer your question?
Yes, thank you, absolutely. And will you have, like, generally, you have to teach medical students or other levels? Are they all medical students or junior doctors? Am I right?
Yeah, so it just depends on the day. Sometimes they will say this is ST1 or medical students or foundation doctors. I don't think it really matters. I think still sticking to the basics is the best, and keeping it simple is the best. Even if like ST1 or ST2, I know that they will know a little bit more than the medical student, but still. And again, it's not about the knowledge. It's not about what you say. It's about how you say it.
Yeah, thank you.
No worries.
Any other question? And this session will be recorded and it will be in the website of the British Sudanese Association of Pediatric and Child Health
Yeah,
within
good.
a couple of days. There is a lot of thank you, Khalid, and it is very useful
You're more than welcome. No
teaching
worries
and
at
very
all.
useful tips.
I just try to apply the rules of teaching myself, so and to be as interactive as it can get. So perfect. So thanks everyone, and thanks for having me. PSAPCH is always a nice place to come to. So thanks everyone. And if there is no more questions, I will leave it there.
Thank you so much.
Bye bye.
Please don't forget to fill the feedback, guys.